And do you want me to start with an intro on each of those, or does that intro?
No, just talk about the disclaimer's fine. I would just be like, this is a video on for people that suffer with
Okay.
blah blah blah, or this is an exercise for people that suffer with blah.
Okay.
Yeah, that's what I would do.
Okay. This is an exercise for people that suffer with knee pain. It's one of the most common issues that we treat here at Bridge. And so I want to show you just some movement and some muscle activation exercises you can begin with. So we're going to first start with the chair. If you can't get your knee up to a chair or don't feel that you have good enough balance to do that, make sure you're holding on to something. So I'll show you as I hold on here. You can also use just a step in your house. But the idea here is we're going to put one foot up on the chair, can hold on to something for stability, but we just want to add some motion to the knee. So just want to move through a pain-free range of motion. Nothing should be hurting through this. You may hear some clicking and popping. That's just imbalance in the joint. Some muscles are pulling too hard and some aren't doing their job well enough. Again, if you have any pain through this, make sure you let someone know and do not continue past pain. Same repeated on this side. Just gently mobilizing in. Spend about 30 seconds on each side just to get some good motion through the joint itself. The second exercise I want to show you is activating some of the muscles in the knee that often atrophy and aren't doing their job anymore and then lead to knee pain. For this, I'm going to use a foam roll, a very small foam roll. At home, you could use a towel rolled up. You could use a paper towel. Anything that creates a little bit of space between the knee and the floor. You're going to put it right underneath your calf, and all we're doing here is lifting our toe all the way up toward the ceiling, and this muscle on the inside of the knee, it's kind of has a teardrop shape to it, and that muscle you should feel it underneath your thumb as you lift the toe. And I want you to get to the top and squeeze for about 3 seconds, and it's the last 3 degrees of this that makes the biggest difference. So just squeezing toward the top and doing about 5 of those, and switch to the other side. Those should get you started in dealing with some of the knee pain you may suffer with.